Hello everyone, and this is Dr. Jaya from Dr. Gaurang's team from the Academy of Classical Homeopathy, Mumbai. And today we are very honored to be invited to your college to say something about art of repertorization. And I would be felicitating a video, especially by Dr. Gaurang, and he has prepared. He has prepared a video for you to go through the Kent repertory and how Dr. Kent has started his journey and how we can learn Kent repertory with the help of some rubric hunting. So I won't take much of your time and will start sharing my screen. And it would be best if you all can have your Kent repertory with you, because we will be going through many rubrics and it will help you if you have your Kent repertory with you. And if you have any questions, you can write on the chat box, and we will also take some questions at the end. And my colleagues would also be joining and presenting some cases under the guidance of Dr. Gaurang. So let's start for today.
Ma'am, before starting our today's session, our college wants to welcome you all.
Thank you. Thank you so much, Dr. Naman. It's a pleasure to be here in this lovely morning.
Dr. Zerah ma'am is going to welcome you all, ma'am.
Okay.
A very pleasant good morning to all of you. Myself, Dr. Zehra Haq, HOD Pathology, Antarbharti Homoeopathic Medical College, Nagpur. So, I welcome you all to the new day of our webinar series, national webinar series that is going on since some days to upgrade the academic activities. I welcome you all, ma'am, your team, and I welcome, sir, I welcome your team of Classical Homeopathy Mumbai, and I welcome our director, sir, our principal, sir, and all the viewers and all my students. So today we got a very marvelous opportunity. We got a very good speaker who is a teacher of the Classical Homeopathy Mumbai team. And today we are going to study in a different theme, a very different theme from everyday's normal webinars. So I welcome the team and I welcome sir, that is the great orator and great doctor, Dr. Gaurang Gaikwad sir from Mumbai and his team. And I welcome Dr. Jaya Joshi ma'am. Yes ma'am, you can start please. Welcome ma'am.
Thank you, ma'am, for your lovely words. And I am very grateful for the college that they have invited us to give this talk. And on the behalf of Dr. Gaurang, I am thankful to be here. And let's not just waste time and go on with our today's topic. And I would be felicitating this video. And if you have any questions, anybody has any questions, they can, if it is possible, they can type down on the chat. Okay. And if you have any queries, you can just raise your hands, or Dr. Naman can help me coordinate, and we can stop the video and take some questions. Okay. Okay then.
Okay, ma'am.
Let's start with our talk for today. Repertory of Materia Medica.
Can you hear it, Dr. Naman?
Yes, ma'am. It is audible.
Okay.
J.G. Kent. When I was in my fourth year internship and little later, I saw that very few people knew the Kent repertory in and out. And I would see that there were 2-3 homeopaths who I knew, like Dr. Vijay Vaishnav, like Dr. Sorpa, Dr. Sankaran, some more people. They knew all the rubrics and they also knew the remedy in front of them. I was like, how do they know that? It's such a huge book. So then I found out. I kind of found out how they study after kind of spending a lot of time with them. So what they used to do is they used to cut the repertory in different parts. And they used to make small booklets out of that. And they used to keep reading all the rubrics in their free time. So that, they used to get familiarized with the rubrics and the remedies. And then they used to see the patient. And in the patient, they used to constantly look at rubrics. And that's how they got idea. So what I did, I took my Kent repertory, divided into 5 parts. Mind section I removed. I kept a separate. Then generalities I removed. Then the respiratory, cough, like that I kept separate. Female chapter. Like that I made 10 booklets out of Kent repertory as a cart cake with help of, like I made small books with the help of that. And then wherever I'm traveling by bus or by train, I would take, the mind section or the cough chapter or generality. I would keep going through it like this. This kind of madness is required a little bit. Crazy, no? Did you ever try anything like that? Try it. It will give some meaning to your life, maybe. Will you do it? Acha, we will see. You do like that and send me the picture. Chalo, I will wait. How many copies of Kent repertory you had? At one point again, I had about 4 or 5 Kent repertories. Yeah. But I started from part. I started probably from Boger synoptically. Then Kent and then Potter. Importance given to mind symptoms. This to you about Kent.
Can you hear
Kent
it now?
was, he spent a lot of time with Emanuel Swedenborg. And Emanuel Swedenborg was kind of working at a mental asylum. And when he was studying many patients, he realized that everything boils down to your will, your choice, the way your inner patterns are. And when Kent saw all of this, he then realized that disease, physical symptoms are just end products of something more deeper. And that's why in a lot of Kent's writings, in his philosophies, in his Materia Medica, you would often see a lot of importance given to mind symptoms. Given a lot of importance given to their will, their mind, their mental state. I believe that comes from his stint with Emanuel Swedenborg. And that's why, even if you ask me, for me, the first few years in my practice, or the first few years after my college, I was, I was totally into boric and giving remedies based on boric Materia Medica, because I was studying with Vijay Vaishnav. So he used to prescribe based on boric and allergens. Then I spent a lot of time with Dr. Segal's method, with Dr. Milind Rao. I learned about mind rubrics. And I spent a lot of time then trying to understand delusions. Then I spent a lot of time with Dr. Sankaran, understanding the kingdoms and all this kind of thing. Then with Dr. Shorkot. So as I would spend time with different people, my mind would get influenced. Luckily, I spent time with so many different people that I was able to, at some point, understand that I can use all of this together and that these are just different sides of the same coin. Many people go to 10 people and they get confused. But that's where I kind of was very grounded about everything.
There is interruption in voice, man.
If you want to understand the philosophical background of Kent, it's very interesting because he puts the first chapter as the mind and the last chapter as generalities and the middle chapters as the different systems or locations. He divided it into 37 chapters. And although we don't talk so much about it, the biggest chapter is of extremities. So he gave a lot of importance to physical particulars as well, which we normally don't think about. It has many clinical symptoms also. Kent has. Let's take one basic example. Let's study one chapter to have a look. Where are you?
So it would be best if all can open their Kent repertories, and we would go chapter by chapter as Dr. Gaurang is going in this video. So I hope everyone has a repertory with them. or maybe some of them has a repertory with them.
Second. Achha, chalo. Let's see. So how he has given, have a look. Huh? This I am opening the rubric vertigo so that you don't get a vertigo. Okay. So you can see every chapter, he starts first with the time modality. Vertigo in the morning, vertigo in bed. So even as soon as he gets up in the morning, when he's in the bed, he gets vertigo. Vertigo. So this is giving timing, morning, forenoon, noon, night. Then he's talking about modalities like vertigo, air open in, vertigo, alcohol after. So someone drinks alcohol and then feels vertigo, like that. So he has then given all the modalities like this. And many clinical rubrics he has given, like vertigo, chronic vertigo for a very long time. One of the very important remedies, phosphorus. Then many alternating symptoms, like vertigo alternating with colic, viratrum. So in this way, you have to study all the rubrics like this. Huh? Then he has also given inside the chapter what area they fall on, like vertigo fall tendency to, which side do they fall? Backward, left, forward, essay. And so on. You can read about all of this. So interesting the way he has structured the repertoire. So what I'm going to do now is I want every one of you to keep Kent with you. Okay? So I'm going to tell you some symptoms and you have to open the repertory and find the rubric. Can we do that? This is what we call as rubric hunting.
So now Dr. Gaurang would be going through some symptoms, some pictures, and it would be best if everyone can look into their repertory and just type down on the chat what rubrics do you think of, because he would be saying some symptoms and you would be given a minute to hunt for the rubrics, and you can type it on the chat box and then we can see the answers that Dr. Gaurang is giving.
Okay, so I will tell you the symptom and you have to open the Kent repertory. I'll give you only 1 minute per rubric. Okay? This is how you have to put it in. Chalega. Done. And you know, person who gives the maximum answers, I'll give you a chocolate when I meet you. Whenever. Exact rubric, huh? I want all of you to answer, all 250 people.
So you all can see the symptoms on the screen, I guess. So the symptom is vertigo, and they are scared of walking in narrow places. And he feels that
there are many rubrics, but the top rubric will be in vertigo chapter, walls of house seem to be falling on her. Interesting, no? There are many more rubrics. There is one more rubric which comes very close. Walls of house seem to be falling on her, yes. And there is also delusion walls are coming towards her. It's also there in delusion chapter. You can check it out later. Okay, next rubric. You have to tell me, this is like very important. Patient comes to you with a lot of headache. You ask, what is the symptom? And he says, I get a lot of headache, but I feel like drinking very strong kadak chai. I want a very, very strong tea. And once I drink this strong tea, I know I will get better. I feel much better drinking strong tea. Batao, how will you analyze?
it would be best if you can write the rubrics that you are getting in the chat box. That's the way we would learn all the repertories. We would appreciate not to write the remedies, but the rubrics that you're finding.
Yes. So Kent has given a very nice rubric. Have a look. Very simple rubric. Head pain, general, tea, strong, ameliorate. So interesting. देखो carbolic acid. Did you ever imagine? So beautiful. Huh? Okay, next I'm going to show you a picture and you have to tell me the rubric, okay? What is the rubric? Find out. Tell me. See very carefully, huh? ऐसे ही नहीं. How to see this in the repertoire? बताओ. Has to be in Kent. So let's see what are the rubrics. So, yes, hair, eyebrow, white are okay.
Maybe if you have your Kent repertory, you can mark the rubrics, or if you have your register. Dr. Naman, are you able to hear me?
Yes,
Hello?
ma'am.
Okay, okay. So let us resume. Sorry for the interruption. Yes.
So what is the rubric? Eye open, dislikes to keep the eye open, fear it will aggravate the headache. Physostigma. देखो. Not very easy, huh? Yeah, what? Okay. Doctor, sometimes I feel as if something is stuck at the back of my eyelid. Inside my eyelid, some foreign body is there or something is stuck. कुछ अटका हुआ है. Something is stuck. What will you do? Tell me. Open Kent. Follow Kent. So let's see what is a possible rubric. Foreign body as if stuck from behind eyelid. Pain in the eye, foreign body as if stuck from behind the eyelid. You have to learn this, okay? So what I'm going to do for you, I'm going to send you probably in couple of days or something. I'll send you few cases for you to solve, okay? And then you have to solve that. You have to do that. You have to find the rubric. Every line you have to find the rubric. It is only by solving cases that you're going to learn repertory. If you think, oh, this is the case, it is pulsatilla, you will never learn repertory. You have to take symptom, find out how to see that in repertory, which chapter, what is the exact rubric, what it means. It's a whole art. I spent the last 10 years just behind this. Crazy. But once you get hang of it, you realize it's an art, and it is. And nowadays, when I get up in the morning, I start my cases, and it's it's so smooth, just like a like a BMW. It's patient says, and just as if the patient is giving all the exact rubrics, and just I repertorize that, I get the remedy in exact. I mean, it's just like makhan, like butter. How you take a needle and put it in a banana, it's smooth. Interesting, no? You learn this art of repertory, then you will see, just you will just change the way kind of you look at homeopathy. Very, very artistic, not just scientific, very, very artistic. Patient tells you, doctor, when I start getting headache, everything is double. What do I do? Batao, how will you see? Yes. Vision diplopia with headache. Simple. Okay. Okay. Patient tells you, doctor, when I get this pain, okay, the pain is, very, very extensive in the otitis media, and it is right from the left ear, it goes to the eye. When I get this infection in the ear, the pain is from the left ear comes to the eye. What is the rubric? Tell me. Batao. Chalo. I want all of you to participate. Yes, it's a very easy rubric. Ear pain extending to eye. Nice, no? All right, we'll go ahead. Are you getting this idea? Are you getting this idea of how patient language, how to convert? This is the whole art, huh? It's an art portion here. Let's study further. After I came to know about my uncle's sudden kind of health issue, cardiac arrest, I couldn't believe it. I went into a shock. How could it happen? And suddenly my ears started trembling. But how will you take this into a repertory? Chalo, open repertory.
Yes, doctors. I think now you're getting a hang of it. So, yes.
Yes, what's the rubric? Ear trembling after sad news. Dekho. So beautiful, no? The repertories. I'm telling you now, you're going to fall in love with repertory. You are going to fall in love in repertory after learning this in so much detail. सीखो आप ये. You learn this from me, and then you just see. And start solving cases now. In and around you, wherever you are, in your building, for your mother, uncle, chacha, nana, mama, anyone, whoever you find, take their history. Okay, take their history. Then try to solve. Take their symptoms, convert that into repertory, prescribe. Start from that. Every day, target one case. You have to take one case. In a week, at least 3 cases you should be able to take. Find out. When I was in my 3rd year and 4th year, and I was wanting to do this. In the train, if I look at someone and if I used to scan the person, in a person I will see, and sometimes the face, in the hand there is some acne or some eczema. I will tell him about homeopathy, and in the train I would take their cases. Can you imagine? In the train, in the buses, I used to even have a small medicine kit in my bag that I used to sometimes prescribe in the trains. Dr. Alpesh will tell you, crazy. You need a bit of craziness.
Here, I would like to request all my teachers present to help the students to get the cases done. And if they need any help, please give them your support, because it is important that the students learn the rubric the right way.
Good. Can patient tell you? Sometimes when I'm talking in the meeting, patient says, and the other person start talking, but I'm not able to recognize from where it's coming. It is coming from left. It is coming from right. I can't make out the direction of the sound from where it's coming. Batao, how do you find this? Batao.
We are waiting for your answer at the chat box.
I want every one of you open Kent in front of me right now. I want everyone to have Kent in front of them. Open Kent. All people in and around you, your wife, your husband, your parents, your whoever, they should go crazy. They should feel, who is this person? What is this person doing with such a huge book in front of the webinar? They should go crazy. So what is the rubric? Yes, hearing illusion. Sound appear to come from left side when it appears from right. Another rubric very close. Hearing impaired, direction of sound cannot tell. Very close rubrics.
Yes, Dr. Suvarna, you were right.
Dekho. Interesting, no? One patient comes to you, tells you, hearing is very difficult. I can't hear many things. Well, I asked, how did your hearing problem start? Oh, I had gone for a big traveling assignment and there was a big accident. After that accident, suddenly I got very scared. And after getting scared, I think my hearing got affected. Which rubric should be taken? For that, you have to check Materia Medica. So I'm just giving you a little idea about the possible rubrics. Yes, so what is the rubric? Hearing impaired fright after. Dekho, magnesium carb. Interesting, no? Step by step, this is how you are learning. The patient is saying, open the repertory. I wish we could have maybe a 1 month program where I can call all of you to Bombay and sit with me and I can teach you full pleasure and make you see cases, make you solve cases right in front of me. That solve this case, take history. That is the way you have to learn. How will you see this? Batao. Walking and moving, the swelling reduces. Batao. How will you see this? Batao. Tell me.
Dr. Preeti is better by walking. The face bloating is better by walking.
So what is the rubric? Let's have a look. Swelling sensation on entering the house. Dekho. When he goes in house, there is swelling. Dekho. See the exact Can you imagine such rubrics are there in the repertory? What I'm trying to do, I'm getting you familiarized with repertory. I'm making you make friendship with Kent repertory. He's your friend. He will support you. Phenomenal, no? देखो Okay, now you have this small picture I've shown you. Okay, this is the picture of the teeth of a child. Okay, now you tell me what rubric will you take for this? बताओ. चलो, open Kent, खोलो. Serrated teeth. अच्छा? You think this is serrated teeth, huh? What is this? This is called as cupped teeth. Serrated teeth is different, where the teeth is like this. It's cupped. Yes, Hutchinson triad. This is very common in syphilis. That is why you have to learn repertory, my friends. Patient tells you, doctor, when I'm eating food, I feel that my teeth is very, very loose. I feel that my teeth will come out. It's so loose that the teeth will come out. Batao. How will you take this? Batao.
Yes, Dr. Riaz. Any more questions?
Yes, so what is the rubric? Teeth looseness sensation of when masticating. Acha? Patient tells you, doctor, I feel lot of suffocation in the throat. And this is typically more at night. And typically, I have to drink some warm drinks that give me relief because it feels aggravated by drinking cold. Batao. How will you analyze this? Open, Kent.
Yes, Dr. Priyanka. Any more suggestions?
So let's see, what is the thing? Throat suffocative sensation. Cold drinks at night better by warm. Dekho, calcarea floor. Can you imagine? Did you ever think calcarea floor in this rubric? Hello? Anybody home? Did you imagine this remedy here? Oh, it will broaden your vision, I told you. You know, there is almost 6 months for 2021 to finish. Next 6 months, next 1 year, just give yourself to mastering this science. Just master. Just train with me like this. At the end of 1 year, you will be able to solve many, many difficult cases. Just learn like this. Gradually, step by step. Priyanka says, आज मजा आ गया. अच्छा, मजा. चलिए, ये भी ठीक है. Anyways, chalo, let's go ahead. Doctor, I went to watch an IPL match and I was shouting, Dhoni, 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 and I was screaming, ah! And then suddenly my whole neck here got swollen. What should I do? Dekho, tell me. Tell me, how will you take this? Batao. Chalo, open Kent, kholo.
Any suggestion, doctors? Anyone else? Dr. Suvarna has said throat pain, sore, straining after.
Very nice rubric, no? What the rubric? Swelling throat when speaking loud. Dekho. Chalo, next. I feel very hungry, but as soon as I start eating food, as soon as I just start eating food, my hunger goes away. Batao. Tell me, how do we analyze this? Kholo, open Kent. Come on.
काम करेगा
खोलो ओपन देखो
So I think Dr. Prashant Bharbad, the principal, is here. I welcome you, sir.
ताड़ाताड़ी अच्छा. So what is the rubric? Stomach appetite vanishing on attempting to eat. देखो. So interesting, no? देखो silica. And yesterday we learned silica. What is ravenous? What is the difference between appetite canine and appetite ravenous? Appetite canine comes from the word dog, no? Canine. So what is appetite canine? Canine is you eat like a dog. Huh? Appetite ravenous, raven comes from the word raven. Appetite ravenous means like, little bit. Appetite ravenous. देखो. So interesting. देखो, this is the way you have to gradually understand the deeper meanings.
Yes, Dr. Priyanka, you can take that. When the appetite diminishes, like he doesn't want to eat, he doesn't even want to eat when it's time for the dinner or lunch or breakfast. But here, when he takes the first spoon, the appetite is vanished.
Doctor, patient tell you that I'm getting in the COVID, lot of fever chills. Lot of fever and chills. But during the fever and chills, there was just no appetite, no thirst. But especially when I don't have fever and chill, the stage between the fever and chill, I feel very hungry and I feel like eating food a lot. I feel very, very hungry. Batao. How will you take this? Batao. Kholo. Content. Tell me exact rubric. Exact. Doctor, just few days back, I saw a very scary movie. Stree. I saw this movie, Scary Stree. I saw this very scary movie. And suddenly after that, I developed this metrorrhagia, bleeding. And this bleeding is just not stopping. What should I do? Batao.
Good, Dr. Swarna.
Very nice rubric, no? Very important rubric. देखो, metrorrhagia from fright. देखो.
I hope everyone is getting to learn something and going through the pages of Kent repertory. People in the auditorium or the classes, are you getting to learn something? Okay. We'll just have 10 more minutes or some more rubrics, and we'll start with some cases. Okay. Yes. Okay. Let's go ahead. Yes.
Doctor, whenever the weather is bad, my throat gets very much affected, but I'm unable to speak. But after talking for some time, then my voice gets better. The hoarseness improves.
कुठे दुखते पाठ तर मसल मसलला ते दोन टाकतात
Hello.
असं वरून दाबलं
Any suggestions, doctors?
Voice hoarseness talking improves after a while. They go. Can you imagine rubrics like that are there? See the exactness. Isn't it so beautiful that everything patient says is written in the repertory? They go. So amazing, no?
I think that's it from our side, from Dr. Gaurang's side. That's it for the rubric hunting. And now I would like to invite Dr. Utsav, and he will be presenting a case. I think Dr. Utsav is with us here. I think Dr. Gaurang also has joined from France. So,
Okay.
Welcome, sir. Antarbharti Homoeopathic Medical College and Hospital welcomes you.
So thank you so much, Antarbharti
Welcome.
Homoeopathic Medical
Welcome,
College.
So I hope you can hear me and see me. Good afternoon, everyone, and thank you for inviting me to share the presentation and case today. So I will be
Before
sharing the
that,
case where I was assisting Dr.
can you
Gaurang
hear
and
me,
I was
Utsav?
following up with the case in between. So let us start with the case today.
Excuse me, sir. Dr. Gaurang, sir, is trying to say.
Yeah. Can you hear me?
Yes,
I
sir,
hope
we
you are
can
able to
hear.
hear me. Okay.
Yes, please.
Yeah, I will just request Utsav to wait for a couple of minutes. So, first of all, I want to thank Antarbharti Homoeopathic Medical College and Hospital to invite us to you guys. And I hope that all of you are doing well. And I hope that the homeopathic studies there is very good. So we have a very good homeopathic team here in Mumbai. And you already heard some of our doctors. Now we are going to have one of our most dedicated and one of the finest doctors who's studying with us, Dr. Utsav. Then we will have Dr. Shivani, also one of the very dedicated and very, very fine homeopath. Then we have Dr. Shrishti, Dr. Megha. We already heard Dr. Jaya. So what we have done is we have brought together some genuinely good young homeopaths together to share with you some of our work. So I'm very happy that you get an opportunity to see these cases. But what I want to also tell you is that in your college studies, and college is very important, learning in the college is very important, finishing your studies, exams are very important. But it's along with this, you will have to do a lot of self-study. You will have to read a lot of materia medicas. You should know by the end of fourth year, you should know the entire Allen's keynotes at your fingertips. You should be knowing the Kent repertory, at least the mind section by internship. You should have read at least 3 books in your college days: Nash, Tyler, and N.M. Chowdhury. At least these 3 materia medica books, you would want to at least read it once in your college days. I told you when I was in my college, by the end of fourth year and beginning of internship, there wasn't a single materia medica book in my college library that I hadn't read at least once. I don't want you to be as crazy as me or someone else, but you need a little craziness to be the best. Homeopathy, many of us may think what kind of profession it is. Well, I want to tell you that as the great Robert said that, as young man, what you can give to homeopathy, homeopathy will give you even more. So this is what I want to share with you. I hope that you take this as an opportunity to grow, to evolve. I'm going to offer something very special to you. I will request Dr. Srishti to share that with you, that for all the for all the participants of the current webinar who are watching, we are going to give you access for a special 100-hour certificate course as a gift from me. So you all will get a 100-hour course, and if you watch the entire course and solve one case, we will give you a special certificate course, a special certificate that you finish this 100-hour studies with us. And then if you're interested, then I will guide you further. So this is what I'll request Dr. Srishti to share about it from you. So yeah, that's what I wanted to say. Bonjour from France. I hope that someday all of you will also spread homeopathy across the world. Having said that, also we have Dr. Ibtisam Ambari, who specially organized this with the help of the special college principal who's here with us and all the teachers. So now all over to our youngest and the finest homeopath we have right now studying with us, part of our team, Dr. Utsav. Now he will share an interesting case with you. Thank you.
Dr. Gaurang, we have the principal of the college, Dr. Prashant, with us. Doctor, a few kind words from your side.
Good morning, everybody. Thank you, Dr. Gaikwad, sir, that you are giving a series of knowledge to my students and all those who are learner of homeopathy. And with that, I will hand over the mic to Haq madam, that you will continue your session. I'm busy in some work.
Great. Thank you.
Yes, sir. Your team can continue it.
All right.
Okay. Thank you, everyone, to join us. Thank you, Dr. Gaurang. Thank you, Dr. Zehra. Dr. Utsav, I would like you to take the stage now and present your case. Thank you, Doctor.
Thank you, Dr. Jain. Thank you, Dr. Gaurang, and also a college, Antarbharti College. I hope can you hear me and can you see me? So I will start the case now, which I was assisting with Dr. Gaurang, and I was following up with the case in between. So it was a case of subacute sclerosing panencephalitis in a 5-year-old male child. You can see here that a patient was already admitted in hospital even before we visited hospital. He was in this situation. He was in a comatose situation actually. So here I will just explain and share the symptoms which were present before we saw the child. So the child was already suffering from cold and cough, and at the same time he also had a bleeding from nose and mouth. He also had a rashes all over the body. So he was taken to the Sion hospital by his parents, where doctors suspected that it could be a case of measles. So they asked parents to shift to another hospital, and the name of the hospital was Kasturba Hospital, which is another name of Kasturba Hospital is a very highly infectious hospital, where all the cases of infection gets admitted in Kasturba Hospital under government. So patient from Sion Hospital to Kasturba Hospital was already taken with the help of ambulance, and he was already IV glucose was already going on because they could suspect that child can be critical anytime. So as soon as the child reached to Kasturba Hospital, the many tests were done, and it was diagnosed as a case of SSPE. And he was admitted in hospital since last 3 days in Kasturba, where he was not responding at all. In next 72 hours, he didn't respond and he went into the comatose situation. Now, this was the time where he was given a timeline of 24 to 48 hours. Doctor said that child may survive if the survival chances will increase if the child responds in 24 to 48 hours. Otherwise, we may lose him. So this was the time where his parents, child's parent, thought of starting a homeopathic treatment. That's where they called us, and we visited hospital. You can see the pictures of child. He's lying in the bed with all the pipes in and around, and you can see the blood pressure, which is roughly 125 by 92 mmHg, which is quite high in cases of child. Now, this was the time where we started examining the patient. And as soon as we started the examination, we saw that the child is running a high grade fever of roughly around 101 Fahrenheit. And his Glasgow coma scale was 4. Generally, it should be 15 to see a best response. You can see in this picture, when we say it is a comatose client, it should be 8 or less. And when we say it is totally unresponsive, the score is 3. Remember, the score of our patient was 4. So according to this chart, it comes nearly to unresponsive situation. So we continued the examination further. On examination, we come to know that the child abdomen, especially the umbilical area, was very, very hot to touch. And the feet and hands were cold to touch. Though the patient was unconscious, we could see some reflexes in him. He was coughing in between. And we saw that when he is coughing involuntarily, his cheeks are drawing in. Generally, when we cough, the cheeks blows out, but in his case, it was going in. So we confirm with the patient's parents that is it happening for the first time, or he used to get these symptoms of cheeks going in before also. Then his mother said that whenever the child gets cough, he has this symptom of cheeks squeezing in, which was very peculiar for us. Then we started asking parents about little bit to understand the past history of child. We started uh, asking the question that please tell us about a little bit of birth history, and from birth till now, how was he in a development. So parents said that he was already a diagnosed case of Wilson disease at birth, and since birth only the child is very, very slow, very, very weak, very, very dull. The concentration level is very weak, and the child was always clingy to mother. No one, but always used to with mother only. So this was the case history which we got. Generally, in cases of child, we also take a gestational history in the consideration, but here the parents were in panic situation and they were not able to give a much further case history. So this was the case history which was available with us. Now what to do? The question comes, how do we analyze this case? How do we repertorize this case? Case to le liya, but now how to move forward? So please always remember, whenever we want to analyze or repertorize the case, there are 3 to 4 steps. First, we have to make a portrait of the disease. Second step is we have to mark the most important part of the case. Third, we also have to take a consideration of diagnosis, and then we should start repertorizing the case. So our first step for analysis and the repertorization becomes the portrait of the disease. And when we say portrait, what do we mean by portrait? Portrait is we have to make a list of what all important points we saw in this case. So here participant can answer in chat box so that I can see what they could find as an important point or important symptom in this case. Yes, history of slow learning. Ruhi Rotke, to everyone, hands and feet were cold. Yes. Hand and feet cold. We will make the portrait all together. Always one's mother. History of slow learning. Yes. Cheeks squeezing while coughing. Yes, very important symptom. Very good. And high fever. Umbilical region hot. Yes, so we have many most important clinical symptom in this case, and not much of a mind symptoms. So we come to next stage, where what we could see, you can see there is a coldness of the part. There is a lack of reaction. The child is not responding at all since last 72 hours. And the next, a child was given only 24 to 48 hours to show some response. Then only there was a chance to survive. And this all started after the effect of measles, which was very important. And little bit child history, which we came to know from a parent, was that the child was very slow, dull, sluggish, or all the milestones were delayed. This gives us little bit idea about the carbons. So, and as we say that, as I told you, that we should also consider the diagnosis also in the case. And why diagnosis is important? Because the remedy which we will select for the case, for the patient, that should have the sphere of action on that part. So that's why the diagnosis become one of the important tool to select the remedy. Now we come to our next stage, how to repertorize further. And before that, the question arises, which repertory to use? Because we have so many repertories. Now, how to use, which one to use, which one to select? So in this case, I choose the repertory BBCR. But again, the question arises, why BBCR? Why not Kent? Why not complete repertory? Why not Fatak repertory? So here are the few points where why we should use Bogor Boni Hussain in such type of cases. So when we know that the case is of fever, especially, and when we know that it's a deep pathological case, and where the case is very short, not a long case is present, when we have a more of a paucity of symptoms, more of a clinical examination reports, more of objective symptoms, and when we know that it's strong LSMC, which was also present in our case. Location, as we can see in our case, it was a nervous system which was affected. Sensation, we already know that the child was in a comatose situation. Modalities we don't know yet, and the concomitant was, as one participant said, it was cheeks drawing in while coughing. So the BBCR becomes the strong choice of repertory at this moment with this case. So now we have selected the repertory. We have reason to select this repertory. Now the next point comes is to how to choose and what rubric to choose in this case. So I will show you what we did. Remember what was the first peculiar symptom which we noticed in the child? It was the cough, and during the cough, the cheeks drawing in. So what we'll do, we'll go in chapter cough in BBCR. We will select concomitant. And what was the symptom? Cheeks squeezing in, which is cheeks drawing in. And you can see there is only single remedy, carbo-veg. What was the other symptoms in case? We saw that the abdomen was very hot to touch. In abdomen, especially the umbilical area. So we'll go in fever chapter. We'll see partial heat. And we'll check abdomen. And in abdomen, most probably the umbilical area. Right? Then what was the other clinical symptom which was present? Coldness of the hands and feet. So we'll go to chapter cold, and we will choose the rubric coldness partial objective. Now, why partial objective? Because we have examined the patient, and on examination we can see there is a coldness of the hands and feet. In this situation, patient can't tell that whether he is feeling chilly inside or no. Whether it is chills or whether it is coldness, we don't know. But on examination, what we got, it was coldness of the hands and feet. So we'll take coldness partial objective. Upper extremities and hand. Also, lower extremities where feet were cold. And how this problem started? Measles after. So we'll go in generalities chapter where it is mentioned aggravation after measles. And how was his sleep? It was all comatose. So we can see in chapter section sleep, and we can select the rubric comatose. And when we put all the rubrics together, which you can see, and the remedy which is coming up beautifully was carbo wedge. So the remedy selection for the case was carbo wedge. As you can see the rubric here: sleep, comatose, fever, partial heat, abdomen on umbilical region, cold, coldness, partial objective, lower extremities, feet, coldness, partial objective, upper extremities, hand, cough, concomitant cheeks drawing in, and generalities, aggravation, measles after. We also took few rubrics from Fatak repertory, where you can see there is a lack of reaction, and there are some coldness in some part of body and heat in another part of body. So now we shouldn't stop here. Whenever we repertorize the case and the remedy comes up, we should always cross-check in Matita Medica. So as we can see here in Allen's keynote, it is written that carbo wedge becomes one of the important remedy where the person never fully recovered from the past illnesses like measles. And do you remember where I told you the first and initial symptom of patient was lot of cold, cough, and bleeding? So when we see, it is written that carbo wedge is also important remedy for epistaxis. So the selection of a remedy for this case was carbo wedge, and the potency was 10 m. Now why 10 m? Again, the question arises because these are so deep pathological cases where 200 C or 1 m may even not touch the patient, and patient was already given a timeline of 24 to 48 hours. To really stimulate the nervous system, we need a higher potencies. And Dr. Borland has written in his book on pneumonia that higher potency are usually useful in deep pathological cases. So we gave carbo wedge 10 m first, and the child started reacting. We could see a slight response from the child. Do you remember the glass go coma scale was 4 when we met the child at hospital, and just with the 4 dose it went to 9, from 4 to 9. Okay, but again after 2 days there was no response. Now what to do further? Should we change the remedy or should we increase the potency? In this case we gave the higher potency. Now why? Because Dr. Henneman and Kent has written in his book that that the previous remedy and potency has acted for some time, then you shouldn't change the remedy directly, but you should give same remedy in a higher potency. So that's what we did. We gave carbo wedge 50 m twice a day. Okay, and we can see the follow-up after 6 days. His response was miraculous. He was discharged from hospital early. Doctors were happy that the child could survive and he could show some response in 48 hours where the timeline was given. His all the vitals improved and he was discharged within 6 days. Child started getting better and better. His recurrence cough cold also improved. We are still treating this child for other complaints, but he was definitely out of hospital within 6 days, where he was admitted. As you can see the pictures again before situation, this was the time where he was given just 2 days to survive, and you can see the after, that is written that it started bleeding from eyes, nose, mouth, and you can see this clinic of Dr. Gaurang, where the child has come to visit us, and he was happily playing. And as you can see in the video, this is the another clinic of Dr. Gaurang, where you can see the child is in front of us. Thank you. So all gratitude to my guru, Dr. Gaurang, and our team, and also a big thanks to Antarbharti College, who gave us the opportunity to present the case and share our experience. Thank you all.
Thank you, Dr. Utsav. For sharing the case. And now I would like Dr. Shivani to come and present another of a case. And she'll be also sharing why she has used the particular repertory that she has used in the case. So, Dr. Shivani, are you here? And if you have any questions from Dr. Utsav, you can write down on the chat box. He'll be here to answer the questions. Any questions? I hope you are learning something today, different repertories, and how to use BBCR as Dr. Utsav has explained. Okay. Please be free to ask here, and everyone is here to answer your queries. Yes, Dr. Sai, let's take this question after Dr. Shivani finishes her case. Okay. We'll be taking questions. Yes. Okay. Perfect. So, okay, Dr. Shivani, you can start.
Hello, everyone. My dear respected doctors and students, everybody. And thanks for inviting me for this PPT, okay, and for this webinar. So I will tell you about this case. So this is the case of stroke headache. Okay, so post-stroke vascular headache. Before starting about the case, I will tell you what happened exactly in this situation. Is that patient's daughter, who is an homeopath, she called me and she said that my father is having headache. Okay, and it's been like 2 months he was suffering from the headache. And after that, in during that call, I heard that the daughter's behind, she was standing in the hospital. So what happened is that she started telling me that he's becoming very violent, he's not understanding anything, he's not listening to doctors. And in between that call, it's very important for everybody to keep your ears open, when you take any case, to know what is happening in the surroundings. So what was happening is that at that particular timing, so her father was continuously shouting that I will file case against this hospital. Okay, and this hospital, they don't take care of me, they don't understand what I'm trying to explain them, and they are continuously putting the infusions of allopathic drugs, but my headache is not going. Okay, so he was continuously suffering from that, and he was not feeling okay with the treatment what was going on. So he became very violent, he was shouting at nerds, he was shouting at everybody. So I'll tell you, so you can just see this is the image like before the stroke headache, and already many medicines were given. You can see the hand here, he already removed all the infusions. He said that I don't need allopathic medicines because it's not helping me, and it's been about 2 months I'm suffering from this headache and it's not going. So this headache started since the month of November end, and in the December, due to headache, his blood pressure was high, and he developed the stiffness of neck and all those things, and he developed a subarachnoid hemorrhage, if you can see in the reports. Okay, So the treatment was done. What was the thing about, I'll tell you, is that the headache, it started in the month of November, as you can see, and then he got this stroke, and then he came to this thing about the homeopathy. Okay, now I'll tell you. Okay, so I asked her that you tell me about this case, what is happening, and why is the headache so much, what is causing it, everything. So, when you are being a homeopath, it's very easy, Sometimes you keep telling n number of symptoms because you think everything is characteristic. And if you think about this case, and if you go and see this case, what happened is that she had already given me the case history of around 10 pages, and all the good homeopaths have already taken this case, and they have analyzed each and every symptoms what was said by the doctor. So in spite of analyzing it and everything, the remedy was not working. And if you see this image, this symptoms like pressing the head ameliorates. He was already given Bryonia 1m, 10m, etc. Many medicines were given. So since last 7 days, the pain was very severe. Okay, he was not able to tolerate it, and that's why he was behaving like this. Now, if you see about the complaints was a lot, but to cut short down, I've written it in a small. So what happened is that headache with lot of stiffness, which is a common symptoms for a stroke too. Sometimes we may ignore it, but it is very important to know. Check the BP of patients whenever they have these symptoms. So what happens is that whatever she was saying was already related to the stroke, and whatever complaints and everything she has given was already analyzed, and many remedies was given which was not helping. Now during the case taking, I asked her, something would have happened, some exciting factors would have been there which have caused this headache. Because what happens is that when you know that many medicines given not helping, you need to see what was the exciting factor. And it's very important in the case history and the case taking for everybody to know what is the exciting factor. Now being a homeopath already in the chronic situation, she said about many stress, but then I told her what happened recently that have caused this headache. Okay, going to that part, what she said me is that his father, he is very religious, first thing. Okay, so I said, okay, tell me more about this religious things. So she said that he will not listen to anybody. The thing happened is that as he is a political he belongs to a political party, and he is very strong and everything. So what he does, in between that time, what happened exactly is that he praises Sai Baba. He praises his religion a lot, and he was forced, and people were saying him that you should also celebrate Christmas party. Okay, for him the thing was that he should celebrate Christmas party, but he did not like that, and he's the person to whom if you say no to whatever he says, or if you don't do whatever he says, he gets angry, and he may react in a violent way, because he cannot tolerate somebody saying no to him, or somebody doing against him, or somebody's planning and not doing according to him. So that made him angry a lot. And then she said, yes, I noticed since that time he started falling sick. Okay, he was not well after that. Okay, so you see, there are a lot of symptoms you can see in the state of mind: irritable due to pain, no one is understanding him. Okay, and he said that he, please take my picture, please take my photograph, so that I can share it with the public and just tell them that how is this hospital, file the case against them, and I can win in all those situations. So you can see many symptoms. Okay, if you can see, his son is not doing job, etc. He has stress or financial. I told you that she was a homeopath, so she has given everything in detail, but here the important was the cause. So okay, so people, can you share with us like what comes to your mind, if possible? Okay, no problem. So I'll tell you. Okay, so dreams also, you can see many dreams, etc., etc. Okay, so, and you can see the list of remedies which were already prescribed. More than this was already prescribed, but I could write the important ones, which has this indications. And generals was, he was liking desire for sweet, thirsty, and thermally he was very hot. Stools was constipated. Palms were normal to touch. It's very important to do physical examinations also at that time. So if you are doing an online consultation, you can ask somebody else to do that for you. It will help you a lot. Okay. So now you'll think about analysis. What comes to your mind with this situation? So here the important was, I'll tell you, is that first thing, we need to think what repertory and how to approach in this case. First thing, when you know that already many medicines were given, many approaches were used. So you need to think most important was the exciting factor. What had caused this? Why is this headache developed? When you see this, see how you think is about. In this case, important was the physical generals. Okay, and this case does not have many mental symptoms. Okay, already it was said by the doctors many mental symptoms were present, but at that particular point we did not feel it that important. And after discussing it with sir about all the situations, okay, so what happened is that we'll focus more on the causative factor out here. So if you see, the causative factor was what? His will was contradicted, and his situation, his words, and somebody not following whatever he's saying was being affected in this situation. Okay, so cause was what? Contradiction. Second, the state of mind was what? Is the anger. So you understand that this contradiction have caused him anger, which have led him to headache development, and which further developed into the post strokes and everything. You can see the patient situation right now. So the repertory what you'll use is that here a person who really talks about, very important about the causation and what caused it. If you see John Henry Clark repertory, you'll understand it has 3 chapters which has got clinical, causation, temperament. Okay, so when you go into the repertory section, I'll tell you, the first rubrics you'll be taking is that contradiction that is affected, and that contradiction because of what? The anger was suppressed. He could not express it. He could not say it to people, which was causing him more affection, and that's why this have come. But we'll not stop at this, because we were more focused with the general things. And the 2 people who talk very good about the generals is that one, John Henry Clark repertory, and second thing is Fatak repertory. When you go into the Fatak repertory, you'll try to analyze it with all the aspects. It's not just the 2 symptoms which is taken by the Clark repertory. Okay, so when you see in the Fatak repertory, the repertory, I'll show you. Okay, so it's apoplexy, first rubrics that have caused. And if you see, the second rubric is that anger, vexation, irritability, temper, and third is contradiction. So we came to a remedy or a met. Okay, and if you see in the Clark repertory, you can see the cause, contradiction, effect of. And in Clark already it's marked in the characteristic part, the causation is contradiction, that is causing the headache and everything. Okay, but we need to look after the sphere of action, which is very important for selection of remedy. If your sphere of action is not matching that much with the remedies, you may need to think about it twice before giving, because if your action is not on that particular part or organ, how will it act that frequently and that easily? Okay, so which you have been learning from sir also many a times, that sir always tells you that you need to focus on sphere of action. Okay, so when you see about the Clark of repertory from the book Art of Repertorization, which is written by sir, you can read the importance, when to use, how to use Clark repertory from that book, and it is very important. So when you read this, you'll understand. see what it is written. One of the main advantage in using this repertoire is when we study specific rubrics, we often find smaller or lesser known remedies. Okay, and it the basic thing I'll tell you about the Clark repertoire, it has many polycrest remedy, but the thing is that the Clark, he thinks very logically, so what he has done is that he takes one rubric, he takes one symptoms, and whatever the importance is there in that particular remedy, he puts up that remedy in that, and he has seen it, if you see in the Clark repertoire. Okay, and then you have to see it, you have to keep checking it in all the materia medica before prescribing anything, so that you are well sure about it. So if you see that Phatak is also saying the same thing, that mind is affected, circulation, blood is disturbed, headache is caused, contradiction aggravate. And if you see in Allen's keynote also, it's written oversensitive, least contradiction excites growth. Okay, so the remedy given was Oromat 206 hourly for 7 days, and you can see the follow-up after 10 days of sleeplessness night. He could feel much better. He was 50% better in the first follow-up, then he was 70% better, and then he was 90% better. And in that December he got this stroke, and you can see, okay, you can see that he celebrated his birthday on January 15th. You can see that he was back from this thing, and you can see the religious affections behind somewhere. Okay, so this was the case about, and I hope you learn, and you will try to learn more things. And we are thankful that you allowed us for everything. Thank you.
Thank you, Dr. Shivani, for sharing a incredible case with us. If you have any questions, you can type on the chat box. And till then, I would also like to invite Dr. Shrishti Bhandari from our team to present a case. And till then, if you have any questions, you can type down. So how many doses were given? I will definitely ask Dr. Shivani to explain that. And how many repetitions? Okay. Yeah.
So Oromet 4 pills every 6 hourly, as you can see, was given. So depending upon the situation, as soon as the patient was getting better, so when your remedy starts acting, you need to reduce the doses, and also you need to reduce the repetitions of the things. So when it was given 6 hourly and patient felt better for the first time, second time means that remedy is acting, so you need to reduce it. It's like how you'll do that, you were giving it 6 hourly, then you'll give it 2 times a day, and then you'll give it 1 times a day. Simultaneously you'll just reduce it, and then you can see that there are major changes. As soon as the remedies start acting, don't be in hurry, but first start with the 6 hourly things, and then you see if it is acting in a proper way. In that one day the pain got better, then from the next day onwards you can just reduce the doses, will help you.
Okay, so there's another question.
So there is a question, what is the reason to select only Clark and Phatak repertoire? As I mentioned in this case, that already the remedies were given by many homeopaths, and the reason behind, the main reason was, see what happens is that I told you in when I started with the case also, when any homeopath or any doctor is giving a case, it for them, to find the mind symptoms and everything is very easy, first thing. And second thing I'll tell you is that in this case the patient was not available. Okay, patient was not there to talk. I cannot search into the mind sections and keep finding the mind rubrics, because just taking anger, contradictions, or just taking the state of mind, the experience of that patient was missing. If somebody is fastidious, you should know the reason behind that. But here the patient was not available, whom to trust. So that's the reason we have started with this.
Thank you, Dr. Shivani, for letting us know and clearing our doubts. And as many people are writing for Dr. Shrishti, so I'll ask her to explain her case, and after that, we'll also invite Dr. Utsav once again to explain the potency selection and how he has repeated the doses. So we'll be inviting Dr. Shrishti to present another case with another learnings, and I hope we are all having some fun while seeing the cases and learning something. Over to you, Dr. Shrishti.
Thank you, Dr. Jaya. So, hello and a very good afternoon to everyone, all the teachers, principal sir, and all the delegates of today's webinar. So it's really exciting and amazing to have all of you here. And I'll just start by today's case. Another case I'm sharing of Dr. Gaurang, and you have seen already the two cases, how we use different repertory in different type of cases when symptoms are present differently. So I hope by now you learn something and then you can help me or suggest what do we do in this case. So let's start this case. It's a case of autoimmune hepatitis in a 63-year-old male. And this patient came to us with acute exacerbation. So the history before coming to us goes like that the patient, he's a doctor by profession, MBBS MD doctor. He's 63-year-old male and he's suffering from autoimmune hepatitis. So everything was fine, everything was well maintained in his health until he received the first dose of COVID vaccination in February 2021. And since then, he started feeling some lethargy, weakness, low appetite. And so he got his routine investigations done and found that in June 2021, his bilirubin was raised and his alkaline phosphatase, SGOT, SGPT was also remarkably increased. So he got his CT and MRI abdomen also done and find that there are some mild stenotic changes. So he started taking medication for that, but there were not much relief. So he did his auto antibodies test, which was also found to be strongly positive, and his immunoglobulin also you can see is more than 3000. So general physician, he went to MD medicine and they prescribed him with prednisolone or omeracortel, which is a corticosteroid, which is the general line of treatment for such cases. And after a month continuing with the corticosteroid therapy, his bilirubin came back to the normal. His SGOT, SGPT also came back to normal. So he reduced his further work. He resumed his work. He is also the known case of hypertension and diabetes and taking his prescribed medicine regularly. So now he came to us with the presenting complaint. On 26th October 2021, he told us that he has a lot of weakness, and it was a video consultation, and fatigue. He was experiencing fatigue all over the body. There were body aches, there was swelling all over his body. And so he was already a doctor. So he told that there is only this, no other physical symptoms are there, but there is weakness, which is constant in my limb. And he was not able to do anything. Anytime he would try to do or exert himself, he will feel much exhaustion. He was very weak. He was not able to get up from the bed, as we saw in the video consultation. And he also told that his urine was also very high yellow colored, which is because of the non-obstructive jaundice. So he said that there's no other modalities present and presented to us with his investigation. Again, his bilirubin, his SGOT, SGPT were found quite high. His HbA1c was also 8 gram per deciliter. And he said that because it's again acute exacerbation of his chronic condition of autoimmune hepatitis, he started with prednisolone. So we asked him more. He probed deeper into his history. So earlier he was not very reluctant because he was very weak. He was not able to talk and exert much. But we asked him, we explained him that all this is very important. So he said that before all these symptoms, what happened that being the chairman of housing society, they found that secretary of the society has embezzled some money. And being the chairman, it was his decision and it was his responsibility to maintain everything working properly in his under his leadership. And everyone was coming telling him that you should do that, you could have done that, and everybody was coming to him, and he had to be, pacify them. He had to be in the middle to cooperate with everyone, and all this was too much for him. It became too much for him, and he was so much stressed because his wife was also a patient and he had to care for him a lot. So he, one side, his family issue was there. He had to take care of his wife. He had to take care of, his house. And then the next part is the society issue. So he was sort of in a middle of a struggle. And then when it became too much for him, he said like, "Bhad mein jao," like just do what you want, don't bother me. So this was his exact word, that now I said, "Bhad mein jao," I don't bother with them, or I just let them do what they want to do. So we asked his family what was his basic nature before. So he said that he was very sensitive and very mild. He's very compassionate person. He has good relation with everyone in and around his family, in his society, with his colleagues and his staff. And he also promotes alternative medicines. He cares for people a lot. And in the childhood also, he was very mild and very friendly person. He liked to play sports a lot. He would gel up with everyone. And so his basic nature was a very compassionate person, a very mild person. So his physical generals, we asked him what are the changes he's noticing in this acute. So he said that because of all this, my appetite is diminished, my thirst is diminished, but I'm craving for fruits. He said, I don't just want any fruit, I want juicy fruits. The fruit should be juicy. I just feel like I'm having a juice, like citrus fruit I'm desiring. So I'm just eating that, and I'm just drinking the juice. I'm not eating anything else. I just want fruits and sour spicy things. And he said that nowadays I'm feeling that I'm more hot, I'm thermally more aggravated by warmth, and rest of the generals were well maintained. Perspiration was okay, the urine was dark in color, as he previously mentioned. Because of the jaundice, he was not able to tell much about in detail about other physical generals. So what we observed during the video consultation was that he was very weak and drowsy. Even in the consultation, he was speaking very slowly, and he was so weak he could not exert to talk as well. And he was in a sort of, he has given up of the hope because of this too much things going in and around him. So he had given up all the hope. He said, just you do whatever you want, leave me. And because of this continued corticosteroid treatment that was going on, he had put on a lot of weight. And because of the jaundice, his eyes were of very dark yellow color, and urine was also dark. So how do we analyze this case? As you have already seen cases before, so I will just ask you, how do we go forward in this case? This case has symptoms present from the physical level. You see the mental level also coming in the play, and you also see his main complaints. Yes. So I'll tell you how do we analyze this case. In these cases, in this type of cases where there's a strong, and we see like autoimmune diseases, whenever the symptoms come or exacerbate, we see that there is always a very strong emotional exciting cause that is always behind. And what is in this situation? What is it for him? Like he said, that I'm in the middle and everything is going around him. Like someone is saying do this, someone is saying do that. He had to take care of his family, his wife. He had to take care of the society for as a leader. Then there is financial issue involved. So he had this mental state that he was stuck. Different parties were trying him to moderate things. He was mediating, and then at the end he had given up everything, and he was in a state of indifference and apathy. But how do we take this and also have his physical generals, his main problem, his main symptoms of weakness, lethargy, and all the conditions of autoimmune hepatitis in consideration? So two ways we can go forward about that is to find the references from the materia medica and second also to have repertory to help us. Now in analysis, once we see a mental sphere, that where he was in this exciting cause happening behind him, which caused him all these situations, and on the physical level we form the totality that there is physical weakness and that he has great desire for juicy fruits and juices, and then also his basic nature, that he's very mild, he's very compassionate, he's very friendly. So taking all this in consideration, first of all, because now you have seen cases through repertory, we'll take a different, slightly different approach what sir took in this case and how he explained. So this mental state that come up, that he is in a indifferent state, because there is a lot of adverse circumstances, there is struggle for him, and he is now left apathetic. So this exact line is what you find in phosphoric acid given in the Phatak repertory under mind section. Indifferent to everything, apathetic from unequal struggling. This is the unequal struggling that was happening in and around him. One way he has to focus on his family and wife, one way he has to focus on the society. So, and because of this, he is now in the state of indifferent and apathetic. But we also have to consider his physical symptoms and his physical generals. So we took them also. We took that he is now indifferent and apathetic. We take mind, he's in despair, he has lost all the hope. His basic nature, he's very mild, he's very affectionate. And in generalities, because he was not able to exert at all, his weakness would aggravate. And then his desire, which is very marked for fruits and juicy things. So now taking all these rubrics, again in the repertory, we came to the phosphoric acid. Now we see like how both materia medica and repertory, like in this case, we took the materia medica reference and simultaneously we also took repertorial totality and we came to the same remedy. So to confirm more, we will read through more literatures. Like here I have mentioned few lines I have highlighted from the Soul of Remedy by Dr. Rajan Sankaran sir, and you can again read through it, that this is the state that is exactly present to him, which is mentioned in the phosphoric acid. So now we are very sure about our prescription. So we can give him phosphoric acid 34 pills 2 times a day for 7 days. And then what we see in a follow-up. In follow-up, we see that after 5 days, his weakness improved. He said that I'm now feeling better, but there's still some pain in my leg, swelling is still present, his thirst and appetite improved. Improvement in physical generals give us the good confidence that yes, the remedy is correct, the remedy is acting, we can keep him the same remedy and we can slightly increase the potency. After 15 days, his weakness improved by 50%, pain in the legs also improved, his diet, sleep, everything improved, his desire for fruit is still there. And he said, now I'm able to work. He was not now in the state of indifference. Now he's able to focus on his work. So again, we repeat the phosphoric acid with higher potency. And after a month, he said that now I barely feel the weakness. It is around 80% better. And that swelling is also improving. His generals are good. He's able to work. He's able to go to his clinic. So we take it and forward with the phosphoric acid 1 1 dose, and we give cortisone, which is a tautopathic prescription here to remove this layer of corticosteroid, which was given to him repeatedly, to remove that layer so that all the symptoms that are caused because of that, like swelling and weight, this weight is increasing, will also be removed as a layer. So after in his follow-up in the November, he said that his weakness is now much better. He's able to focus on the work. His weight is also reducing, and he also sent us the report. You can see his parameters were also improving. His blood sugar also improved. And before, his SGOT, SGPT were in the range of 600 and 800. Now after the treatment, they are in the normal range of 35 and 50. His HbA1c also improved. So in this case, we saw how materia medica is again a special tool, and how repertory can again confirm what we have read. So I hope that if there's any question, you can ask me, and you learned something.
Thank you, Dr. Shrishti. Students would like to know why cortisol was given
Yes.
as
Because he was on a continued treatment of prednisolone, which is a corticosteroid, and continued treatment with corticosteroids lead to the Cushingoid symptom, like symptoms resembling to Cushing syndrome, like you gain weight, there is swelling all over the body. So all these are because of the side effects of this administration. To remove that layer, we give it in a potentized form.
Dr. Shrishti, can you just
Yes. I'll just share the repertorial chart. You can see the repertorial chart here.
Okay. Thank you, Dr. Shrishti, for sharing a great case with us. And as always, there's a question about selection of potency. So I would like Dr. Utsav to take that question at the end. And for now, Dr. Megha has also prepared a short case for us, and I would like to invite her. Thank you, Dr. Shrishti.
Thank you everyone for this opportunity, and I hope everyone enjoys today's session and learn a lot.
Thank you. So, Dr. Megha Vasyani with us. She's a part of our clinical team, and she will be presenting a short case with us. And I hope you will enjoy this one. And at the end, we will also take the question of potencies and some more hints by Dr. Utsav Kataria. Till then, if you have any questions, please write on the chat box as we would be taking questions in the end. So here is Dr. Megha with us. Dr. Megha, can you please share your video also?
Yeah.
Okay, thank you.
Okay, so hello everyone. So first of all, I would like to thank everyone to give me this opportunity. I will present one short, quick, acute case. So this was a case of 27-year-old male who was diagnosed with dengue. He was admitted in hospital on 30th August 2022. Yeah, so we can see the reports here. He was dengue positive. So we know that thrombocytopenia is the hallmark of dengue disease. And so this same way the patient presented us with these kind of reports where his platelets were dropping very rapidly. I hope everyone can see these reports. So on 31st August, his platelet count was 1,29,000, which dropped further to 96,000 on 1st September, which further dropped to 30,000 on 3rd September. And on 4th September morning, his platelet count was 22,000. And on the same day evening, it further dropped to 20,000. So this was like dropping very rapidly. Okay. We know that normal range of platelet count is 1.5 lakh to 4 lakhs. And in this case, we can see that his platelet count was 20,000. So on the same day evening, we got the call from the patient and his attendants about his situation. So at that point of time, he was feeling very lethargic, feeling very vertigo kind of episodes and blackout episodes. His BP was low. So we asked him, just tell us in details what are the symptoms and all. So he told us that my symptoms started on 30th August with the pain in shin bone, thighs pain, back pain. Then he got the fever. So we generally ask in fever that what are the stages about chill stage, heat stage, sweat stage, what are the symptoms in each stage. That is very important. So he was getting shivering in upper body, face, shoulder, hands. Then he got the heat on upper body. He wanted to cover. He wasn't thirsty much. His perspiration was quite scanty. So he had fever from 30th August to 2nd September. And after that fever was subsiding, as I told you that he was admitted in hospital and they were managing according to symptoms. So when we spoke to him on 4th September, main symptoms which he had, he was having severe headache on the temples, which was better by pressure. Okay. And at that point of time, platelets were 20,000. He was very restless because of these pains. We asked him further what was his state of mind at that point of time. So he said, I just want to go home. I can't sit idle here. I just want to go home. He had desire for juices and fruits. His appetite was not that good. Thermally, he felt chilly. And generally in these cases, we ask attendants to just examine any body parts, if any particular body part is warm, if any particular body part is cold. That is very important in such type of cases. So on touch, his hands were mild cold. And his mother told us on observation that he is very restless. He's not able to sit there. Okay. So how do we analyze this case now? Any suggestions? So we see in this case, there are some peculiarities, like, his headache, severity of headache, his modality that he is better by pressure, his state of mind at that point of time, that he is just not able to sit idle. He was so restless. So these were some peculiarities in this case. So we need to form that portrait and totality and evaluate it further. After evaluation, you will reach to certain set of remedies. From that certain set of remedies, we need to choose some final remedy. But how do we do that? When we reach certain set of remedies, we need to cross question our own remedy, like why this remedy can be given or why this remedy can be ruled out. Because in these cases, we need to be very precise, because this is an acute case, dengue case. In platelets, we already have seen that it was just 20,000. So we need to cross question our own remedy while selecting from that set of remedies. So we took the main symptoms, like, as I told you, restlessness was extreme from the pain, headache was better by pressure. He had this disposition at that point of time that he needs to go home. So when we analyze and repertorize, we reach certain set of remedies, but the most prominent remedy which was coming up was eupatorium. So he was given eupatorium 30 every 3 hours. Now we can see that eupatorium was coming very close to bryonia. Okay, but we didn't give bryonia. Why? See, when we talk to the patient while the case taking, we also see how the patient is talking, how the patient is responding. Bryonia is very irritable. He will not answer to your questions. He does not want to answer. Another thing is, bryonia is not that restless as eupatorium. Okay, so we had a very clear point to rule out bryonia, even though it was covering the symptoms. We need to see the disposition also of the patient. Another point is eupatorium is very fast paced than bryonia. We saw how the platelets were dropping so rapidly, how the symptoms were developing very rapidly. Bryonia is a little slow and gradual onset. Eupatorium points out towards the bones, arm, legs, shin bones. Eupatorium is very restless, and it also comes closer to Rustox. But in Rustox, movement ameliorates. Okay, sweat is scanty in eupatorium. Almost all the remedies, if we see bryonia, arnica, Rustox, every remedy has this profuse sweat, and they have the action on the bones and headache, all the symptoms which patient had. But the eupatorium sweat is very scanty. Bryonia is hot. Eupatorium is very chilly. Eupatorium is good remedy for viral disease like dengue. Okay, so when we give this eupatorium every 3 hourly, we saw the follow-up. His platelets increased to 26,000 within 10 hours of medicine. Appetite was good. There was no headache. Weakness was better. Appetite improved. State of mind was much relaxed. He was not that restless. And then after 24 hours, it increased to 46,000. After 36 hours, it increased to 1 lakh. You can see these reports here. I hope it is visible. He was discharged from the hospital within 2 days after starting homeopathic treatment. So this was the beauty of Repertorium. Thank you.
Thank you, Dr. Megha. And for the last question, I would like Dr. Utsav to answer the question, and then we'll be wrapping up the session. Dr. Utsav, if you can answer the question of the potency and how we can select the potency in acute cases.
Yes. So I guess the question was why 10M in this case. So because as you can see, the case is so pathological. So if we select a 30, 200 or even 1M potency in this case, the remedy may not touch the nervous system so fast. And the timeline which was given to patient in this case was just 24 hours to 48 hours. So we can't wait with the lower potencies. So that's why the remedy with higher potency was selected, which was 10M. And again, the question can come up, why not 50M instead of 10M? Because when you give 10M and when you know that the reaction is coming up, there is a slight response, you can change to 50M. Because if you give directly 50M, then the next potency which comes up is CM and then LM, which are sometimes little difficult to find for patient. And also sometimes the CM potencies are not available. So that's why the remedy selected, the remedy with the higher potency which was selected was 10M. So this was the main reason for the selection of 10M. And then we jump to 50M.
Okay, thank you, Dr. Utsav. And if there is any question, feel free to write to us. Yes, there's a question that why it was not started with 200 and then increasing the potency later.
Yes, because we don't have that much time, sir, to give 200 and then see and wait for the response. That's why we have to start with the higher potencies. And also there are two good books where you will find why to choose higher potencies in deep pathological cases. One book is a book by Maganbhai Desai on book coma. You will find the literature there, and he used to use only higher potencies to treat comatose situation, 10M, 50M directly. And another book which you will find, which I shared during my presentation, was a book on pneumonia by Dr. Borland, where he also used to use a higher potency in deep comatose cases and also in deep lung pathological cases.
Okay, thank you, Dr. Utsav, for sharing all your knowledge and sharing the cases. I would like to thank the team. And for having us today, I would like to extend my gratitude to our college, Antarbharti Homoeopathic College from Nagpur. And I'm really thankful to the director, Dr. Bhau Saheb Zite, and our principal, Dr. Prashant Bharbhat. And also I would like to thank all the teachers there, Dr. Nilima Banore, and Dr. Akhilesh Khan, Dr. Zahra Haq ma'am, and Ruchi Sahu ma'am, Pradnya Shinde ma'am, Tripti Chaudhary ma'am, and also our coordinator, Dr. Naman. I would like to thank you for arranging this webinar so smoothly. And at the last, I would also like to thank Dr. Ittesam, who has reached to us and has given all the students and us the platform to interact and take homeopathic to great places. And lastly, thank you, Dr. Gaurang, for sharing all this learning with us and taking us under your feathers. And at the last, I would like to thank the team from Classical Academy, Dr. Utsav Kataria, thank you for sharing your case. Dr. Shivani Shukla for giving us insights on Clark repertory. Dr. Shrishti for explaining us the importance of mental and physical symptoms. And Dr. Megha for giving us a really nice acute case. Thank you, everyone. And if you have any questions, you can write to us. I will type down Dr. Gaurang's email ID here. And also you can check out our website if you want to learn further. And as you already know, we have our academy and there are courses that are going on there. And if you need anything, any type of guidance, you can get back to us. And as a gift, as that Dr. Gaurang has already said, we will be gifting you 100-hour courses. So I would like the team, the teachers to get back to us with the email IDs of all the students that has participated today. And we will discuss this further with Dr. Naman and Dr. Ittesam and all the team of the college. So we can provide that to all the students that have been here today and being patient with us for all through the lecture. Thank you, ma'am, for having us. Thank you all the teachers and principal sir and the director for having us today. And also the students, thank you very much. Thank you very much for being patient.
Thanks, ma'am. So today we all got a golden opportunity to learn from such a learned team of Classical Homeopathy Mumbai, and a great teacher and a great author, Dr. Gaikwad sir. Now I invite our great teacher of anatomy, that is Dr. Shruti Chaudhary ma'am, to give a nice vote of thanks. Yes, ma'am. Welcome.
Yeah. Honorable dignitaries, distinguished guests, respected Director Bhausab, and dear participants, on behalf of Antarbharti Homoeopathic Medical College, Dabha, Nagpur, and entire AHMC team, I feel immense pleasure to propose a vote of thanks. I thank the organizing committee for giving me such a golden opportunity. Today, we are in the seventh golden day of this national webinar series being conducted by Antarbharti Homoeopathic Medical College. Today, we got a chance to listen to a very best, one of the most popular teacher in homeopathic field and successful practitioner, respected Dr. Gaurang Gaikwad, who spared precious time from his busy schedule to grace this occasion and enlighten all of us with innovative ideas on art of repertorisation and case presentation, and also make it very interesting and very inspiring for students. It will be beneficial for all of us. Thank you, sir. I would further extend the hearty thanks to Dr. Jaya Joshi and entire team, Dr. Utsav Kataria, Dr. Shivani Shukla, Dr. Srishti Bhandari, Dr. Megha Vasyani. I would especially thanks for the nice case presentation. I would especially thanks our director, respected Bhau, for his support, and please accept our gratitude for your presence. Let me congratulate to our respected principal sir and whole college for arranging such a motivational national webinar series, and I would take this opportunity to express my deep regards to our respected principal sir, Dr. Prashant Barbat sir, for being a constant motivator and guiding light for all of these. I would especially thank Dr. Akhilesh Khan sir for his unfaltering support. He is the man behind the scene in upgrading academic activities in our college and the guiding force for every new step forward. And Iftisham Ambari, an intern of our college, has taken great efforts in arranging this event. I thank my friend Dr. Zaira Man for enthusiastic anchoring in her sweet voice. Then my deep sense of thanks and appreciation goes to all the team who were live with us and attend this grand webinar with great enthusiasm, made today's event great success. Last but not the least, let me thank Mr. Naman Phule, intern student, for his technical support. And in the end, thank you all for being with us today. Have a wonderful day ahead and hope such a time by our college. Thank you.
Thank you, everyone.
Yes, ma'am. It was a marvelous Thanksgiving. Thank you. I thank all of you once again. Thank you.